Omaha is, in addition to lead-based paint in older houses, which is fairly common in a city that has older housing, of course, but Omaha is also a Superfund site for lead in the soil as a result of smelters that existed 100 years ago and left traces in the yard. So we kind of face a double issue there. The other issue that is coming up more and more is the issue of asthma.
With a tiny amount of effort, we can make a huge impact. We're seeing that with a few resources, we can make a home significantly healthier. As a result of the funding from ASHHI, we've really been able to create a collaborative environment where people in our city are seeing how important healthy housing is to our kids, to our families. We've seen incredible community support from our city planning department, who is integrating code enforcement with healthy housing through their new software system. As a result of the funding from Kresge, we've been able to leverage quite a bit of money from other foundations, from the HDR Foundation, from our CDBG program, through other community foundations in Omaha, and so we've seen that we've been able to do more homes than we even had expected in the beginning.
In the case of Omaha Healthy Kids Alliance working with Omaha, their assistance through the grant was to help the city secure funding for a Healthy Homes inspector, and that allows us to work together with our code enforcement staff so that the code enforcement staff can do what it needs to do regarding enforcing the code, whereas the Healthy Homes inspector can work with the various organizations to bring the resources needed by that tenant or that occupant of that house.
You know, I think Omaha Healthy Kids Alliance is really starting to get the word out in our community about the impact of unsafe and unhealthy housing. I think that we are building collaborations. We are getting other housing service providers to see the importance of integrating healthy housing issues, healthy housing items into their work. And most importantly, I think we are building a community consciousness about how important it is to make our homes safer. I don't think we would be successful without our community partnerships. Our partnership with our planning department is critical to our success, or with the Douglas County Health Department. We are able to enhance the services that they provide and really to help each other out. So there's a lot of things that they can't do that we can, and vice versa. So I don't think that we would be as successful without the partnerships that we've had. We've been able to connect with groups like Habitat for Humanity, Rebuilding Together, people who have national presence that we don't necessarily have, and really see a broader impact in the work that we're doing. We had one family recently where the child who was living in the home was suffering from asthma, as well as some of the siblings. So they move into this house and they start getting sick, basically. And we go in and do an assessment and find that there's really significant issues going on in the home that are impacting the health of the kid. And the family is Spanish speaking, so they don't really know what the resources are that are available to them. They don't know how to access them. And because of our work and because of our amazing staff and our very talented bilingual staff, we've been able to really make some significant progress in the home, connecting with other housing service providers who maybe we don't have the funds to do everything, but through this community-wide approach, we're able to access funding and work together using what we call a one-touch program and maximize resources, increase services to families, and make it just a little bit easier for them to get the help they need.
I think there's a number of things that the funding has made in order to make a difference, and that is that we've implemented a one-touch program in order to bring everybody together, and that kind of keeps expanding and expanding. The grant allows the various organizations to work with landlords, whereas the city may not be able to work effectively with those landlords because we also enforce the housing code. So I think that's made a real difference.
Healthy homes means a lot to one community. It means increased property values, increased health, lowering of costs to medical providers. But really it also just means that we're providing a place where children can grow up and thrive.